Thank you, Chairman Sanders. We can agree with the diagnosis and disagree with the prescription because I accept everything you said about the crisis in healthcare. The Obamacare expansion of Medicaid has been unsuccessful at expanding access to primary care. Dental services are paid for by Medicaid for the poor, but they're paid so poorly that dentists cannot keep their doors open. So we can acknowledge a failure of that policy. On the other hand, it isn't important what I think about this. If we're talking about increasing the number of primary care physicians, talking about how do we better serve, talking about workforce, what is probably more important is what stakeholders say. I'll refer to this later, but let me just take an excerpt from America's Essential Hospitals. Essential Hospitals' mission means they shoulder a disproportionate share of unreimbursed care, and I can give you more. These hospitals are concerned that these experts in providing culturally competent care to their marginalized communities will be harmed by this bill. That's important. That isn't Bill Cassidy. Those are the people that are front line in addressing those who are marginalized. Now, let's talk about workforce. Here is from the American Hospital Association. Put another way, provisions in this legislation to cut hospitals and health systems are cuts to the healthcare workforce, as more than half of the hospital's expenses reimburse nurses, physicians, technicians, and other team members. Well, that's something about the workforce provision, huh? And then let's talk about the American, the Association of American Medical Colleges. If we're doing something good for medical training, maybe the AAMC would have something to weigh in on. I write today, however, to express deep concern that counterproductive measures included in the legislation jeopardize patient access to care, etc. Now, it is important what Bill says. It's important what the people who are front line say, and they do not care for this legislation. But I will say, I care about community health centers. Since becoming ranking member, I have worked in good faith to reauthorize community health centers, the National Health Service Corps, and Teaching Health Centers Graduate Medical Education Program before they would expire, and in a way which would get broad, bipartisan, bicameral support, because it has to be signed into law. And for the record, Republicans care about community health centers. As the chair likes to say, President Bush pledged during his campaign to fund 1,200 new health centers. He exceeded his promise in his 8 years, working with Congress to double the size of the program with discretionary investment. The Community Health Center Fund now provides an additional mandatory funding stream to those centers, and I understand the chair's passion for the fund. He created it during the Affordable Care Act. Senate Democrats weren't ready, I'm told, to support a single payer, and so he pushed for this, the mandatory funding, and my gosh, it's a bipartisan priority. And we have reauthorized the chair's fund on a bipartisan basis 3 times. Not easy. Mandatory funding presents logistical and practical challenges, but we've always got there. But every reauthorization has been short. We always fight for longer funding cycles and for more certainty, but we can never find the money. Bipartisan offsets are scarce. Now, the biggest pot of mandatory funding that helps jurisdiction is student loans. What a lightning rod. Yeah, we're going to go after student loans in order to do this. That's not going to happen. When we did the Surprise Medical Billing Act in 2020, it was practically a miracle. We never thought we'd have that kind of mandatory funding, but that gave it to us. And we used those savings for a 3-year extension of the Community Health Center. With that context in mind, I was very open to a funding increase when the chair and I began discussing reauthorization. My goal was to reauthorize the fund on time, which Congress had failed to do in 2017 and 2019, creating uncertainty for community health centers. We need to fully offset our spending. If we're not fully offsetting our spending, we're really just putting out a press release. And we need to have comprehensive HIDE protections. Not big ask, but every single reauthorization has met those parameters. So how do we get where we are today? We're marking up a new proposal 6 legislative days before the program expires. We have no time to align with House counterparts, guaranteeing that we'll have to do a short-term, flat-funded patch. Not a good outcome for community health centers who wished to have certainty and who were scheduled to receive an increase in funding from the House bill should we have built upon that. Now, the chair first proposed increasing community health center funds by more than 500% to more than $130 billion. And he kept telling me to come closer to his $130 billion. I proposed a variety of funding increases, all of which I knew could be offset in a bipartisan basis and within HELP's jurisdiction. And every response was come up to the $130 billion. And with each response, we had new policies, pilot projects, and expansions of other workforce programs. Where we're not going forward, our deadline loomed. Ultimately, I introduced a bill that provides 2 years of increased funding for community health centers, a 5% bump, nothing to sneeze at, and a bill which mirrored that which passed the House Energy and Commerce Committee with a unanimous, every Republican, every Democrat voting for it, 49-0. Bipartisan consensus in a House which typically doesn't have consensus on what to have for lunch. We should have marked up that bill in July and built on its success. We could have used August to pre-conference Senate-adopted amendments with House counterparts and had something ready to go for the end of this month. Now we have the plan that Chair Sanders has just spoken of. But he didn't answer, and which HHS cannot answer, is how many new providers and access points will the funding that would support, that all this money that we're pumping into primary care, how many new providers and access points will this actually support? We know that states are doing their part to address health professional shortages. Does this proposal work with them or work against them? We don't know. I feel like we're doing what is so typical in Washington, D.C. We don't think through a problem, we throw money at it, and then we feel good because we've thrown money at it. And we put the press release out there, and we speak about it on the campaign trail, but we actually don't know that it's going to help. Indeed, frontline stakeholders say it's going to hurt. Would have been nice to talk to the essential hospitals first. We didn't have hearings on that. We didn't invite them to come and comment on this legislation. But all we're saying is that we're going to spend more money, and by golly, isn't that the cat's meow. By the way, the proposal is not close to being paid for. We don't have a CBO score. The chair can speak in an emphatic voice about how this is going to save money long term. CBO doesn't say that. Now, we can pretend they do, but they don't. The chair acknowledges that we have to rely upon other committees to close a multi-billion-dollar gap. And the chair says, oh, don't worry, we'll work it out. Trust me, I'll get the money. Senate Finance will contribute. I'm on Senate Finance. We've not had that discussion. I speak to other members of Senate Finance. They haven't had that discussion. We can't rely upon that. In fact, I hear from Senate Finance, they've got so many things they have to pay for, it's going to be very hard, if not impossible, to share with this committee. That has not been presented to us in that way. Now, we can find money, but it's going to take a bipartisan, bicameral effort to do so. And as other committees coming to the rescue is just, it's the checks in the mail. Now, to a certain extent, this is inside baseball. Folks back home in our respective states, if you're, I don't think we're on C-SPAN, but if you were, you're probably not following. But it's an important context. We can report anything we want to out of committee, but the requirement for attaching committee-reported bills to a government funding vehicle is extremely high. And if you haven't noticed, it's pretty hard to fund the government right now. Controversial amendments are off the table. And generally, this threshold is that chairs and ranking members for every committee of jurisdiction in the House and the Senate, plus bipartisan bicameral leadership, must sign off on authorizing bills trying to hitch a ride on a funding vehicle, including offsets. Now, you can't just go to the CBO's website and copy and paste something from someone else's legislation until you've offset. You've actually got to get that agreement. Now, other chairs have their own goals and priorities to spend the money on. What do the ranking members in the House, what do the ranking members and House chairs of the relevant committees want to do? By the way, if you're lucky enough to spend someone else's money on a goal, the goals have to be more than just meritorious. They have to be consensus-driven that a president typically pushes for in a State of the Union speech. This legislation circumvents a recent high-profile effort reflecting months of negotiation between the President and House Republicans and was broadly supported by Senate Democrats. This circumvents that debt deal. The so-called lockbox the chair creates transfers money between Treasury accounts and directs the Appropriation Committee to spend money on HELP's behalf. The spending doesn't show up on balance sheets, unlike a traditional mandatory funding stream. Now, I know Senator Braun wants this to be paid for. This isn't paid for. This is a kind of ledger domain, money laundering, if you will. It's taking money that should be discretionary and it's putting it into mandatory, contributing to our problem of mandatory spending, driving our nation's indebtedness, and Congress not taking responsibility for otherwise cutting a program or developing resources that would pay for it. And by the way, it doesn't hit the appropriators' caps, and that was the whole purpose. How do you circumvent a hard-fought battle between House Republicans and the White House in order to achieve your goals? Running over everybody else because, by golly, you're right and they're wrong. Well, that's not the way this place is supposed to work. I'm sitting next to an appropriator who has done fantastic work. She can tell you it's hard to get that consensus. This avoids the necessary effort to create it. And by the way, the beauty of this, it pretends to be paid for, but it's not. It's one of those games we play in Washington. We assume we're being fiscally responsible. We put out the press release. We make the impassioned speech. We care about the debt, but it's not paid for. And it probably won't happen. It's cynicism at its worst. I didn't vote for the Fiscal Responsibility Act, and that's what I'm describing. The chair didn't either, but it's the law. And what's the point of passing a law if all we do is navigate around it? We're $33 trillion in debt, and supposedly we're committed to addressing that. Now, if you ask me if I think the chair wants to increase health care access, I absolutely agree. He wants to increase access, and I join him in that goal. But this isn't legislating. If you want to do something for patients, then you actually do the work to find the offsets in a bipartisan, bicameral basis. Don't just say, we'll figure it out. And if you don't pay for it, then all you have is a messaging bill. That's cynical, it's manipulative. You're telling the voters you're doing something when you know at the get-go it's not going to happen. It's one of the worst things in Washington. It's why people distrust this place. The lack of commitment to deadlines, offsets, not glamorous but indispensable. The lack of commitment means that we wasted critical time that could have been used reaching consensus on realistic funding increases for important programs. Aspirations cannot become law. To still be at this step in the legislative process on September 21st doesn't help patients. Instead, community health centers are going to be flat funded for at least several months and maybe for the next year. A failure to build and reach consensus and develop viable offsets and reach agreement across the Capitol hurts the very people the chair purports to wish to help. With that, I yield.